It may be their only chance to have a biological child. Now, more and more couples are turning to gestational carriers to carry their baby, especially if they've had to deal with cancer or other health problems.
But it is an expensive and complicated legal process. To your help today, Kim Posey has more on this alternative and one couple's emotional journey.
Since the day they were married, Paige and Jeff McCoy planned on having a family.
This was our dream.
But life threw this couple from Parker challenge after challenge. First, Jeff needed lung surgery. Then they needed infertility treatments. They got through it and ended up with 3 normal embryos.
We were getting ready to do our frozen embryo transfer. We were pretty excited.
But days before the transfer, Paige wasn't feeling very well and went to the doctor.
She sent me to go get some blood drawn, and that night I found out I had acute lymphoblastic leukemia. And mine was an aggressive form of leukemia.
She went straight to Presbyterian St. Luke's Medical Center in Denver and spent 121 days in the hospital.
It was a little rough. I had a lot of complications. That's why I was hospitalized for so long.
Paige had chemo, total body radiation, and a stem cell transplant, a donation from a total stranger. It was a long road, but now she is in remission.
I'm just ready to go back to living life.
And she's ready to have her family. But after her leukemia and treatment, there are even more challenges.
Because I did total body radiation, my uterus is not the best environment for an embryo.
Paige is unable to carry a baby, and her doctors at the Colorado Center for Reproductive Medicine say she needs a gestational carrier.
They're wonderful women who volunteer to carry a pregnancy. They're all folks who've had uncomplicated prior term pregnancies. And it's usually a very positive experience. We make sure that's the case because there's a fairly complex vetting process during this as well.
But this is an expensive process. It can cost anywhere from $100,000 to $140,000. That pays for the gestational carrier's care, her time, and the legal expenses. That's a lot, especially considering Paige and Jeff already have $97,000 in medical bills. So the couple has set up a GoFundMe account.
It's hard to ask for help, but I feel like after everything we've gone through, we've tried so hard.
And they will try again, this time to find a woman to carry their child and help them have a family.
The whole idea of somebody loaning us their body, I don't know, is a huge gift. I think any woman that offers that is very special.
Well, it does seem like those two are due for some good news. We do have a link on our website to the GoFundMe page and other information if you're interested in becoming a gestational carrier or helping them out.
What a remarkable young couple.
They've been through so much.
Yeah. They have.
Now, how does one become a gestational carrier?
Well, you can work directly with a couple, or you can go through agencies. In general, it is good to be between the ages of 21 and 39, right, healthy, no history of mental illness, and they do want you to have had a full-term, uncomplicated prior pregnancy.
All right, Kim, we hope they find her.
Kim, thank you.